Today lesson is subcutaneous mycosis and continue. Subcutaneous mycosis. What means subcutaneous? Under the skin infection. In this group, there are many infection, but the main are mycetoma and sporotericosis and chromoblastomycosis, but I describe only two this, mycetoma and sporotericosis, because they are more important compared to chromoblastomycosis or the other subcutaneous mycosis. First, about mycetoma. Do you know when we use the word of oma, when we use in which disease, in which disorder in human body, we use the word oma?
Some organ when it is it is become inflammation, it is dilated or explode.
It is not complete answer. Tumor. Yes, we use the oma for tumor lesion, cancer, tumor lesion. In mycetoma, you have tumor-like lesion. Mycet from mycelium. Mycelium means fungi. Therefore, in mycetoma, we see tumor-like lesion from fungi. Okay. Another name is Madura foot. At the first time, mycetoma diagnosed in India, in Madras province, in Madras city. It is an synonym, an old name for mycetoma. In definition, mycetoma or Madura foot lead to some lesion include abscess, single abscess, multiple abscess. No abscess, what mean? Abscess, you can find abscess in lesion. Edema, کوتانوسی که گرفتیم الان ساب کوتانوس. آره که الان میشه. بعد ما اینو بعد با چک، یعنی اینو الان بگیریم، بعد دوباره باید بعد از تموم شدن لکچر بگیریم. آره. سه تا. آره. حالا 5 دقیقه هم میتونی وقت بدی چون اولیه. سلام، صبح بخیر. دکتر تموم شد؟ تموم شد؟ مشکل تو ارتباط یا جواب؟ مرسی. Uh, in addition to abscess, we see edema, a swelling of the limb. A swelling with fluid means edema. May you see sulfur granule. Sulfur granule. Sulfur granule is a compact fungal element in tissue. A compact fungal element in infection, as uh, it has different size and different color, different size from about 1-2 micron to 3-4 millimeter in size, and the color change based on the agent of fungi, may different from white to yellow to green, red, and black. Uh, there are two type of mycetoma. One type, the etiologic agent is bacteria, and another fungi, lead to eumycotic mycetoma, actinomycotic mycetoma. We have two types of mycetoma based on the agent. In actinobacter, in actinomycotic mycetoma, there are some genus of bacteria like as Actinomyces, Actinomadure, Nocardia species, and Streptomyces. These are bacteria from actinomycetal bacteria, Actinobacter. They are different from the other bacteria that you see in shape, cocci or bacil. They are filamentous bacteria. The shape of bacteria in microscopic observation are filamentous shape. Actinomyces, Actinomadure, Nocardia, and Streptomyces. All of them, they are in soil, except Actinomyces israeli, because it is in oral cavity, in GI tract, in uh, rectum, or in vagina. In eumycetoma, they are a long list of mycelial fungi that lead to this infection. One of the well-known of fungi is Pseudalsheria boidi, or P. boidi in summary. Pseudalsheria boidi, another genus Madurella, Aspergillus, Acremonium, Fusarium, Helminthisporium, and many mycelial fungi that all of them are in air, in soil, in plant, in device. All material in media can have a spore of fungi and bacteria. The source of these bacteria and fungi, soil, plant, and device. Based on the etiologic agent that I told you before, we have two types of mycetoma, actinomycotic and eumycotic. Eumycotic by fungi and actinomycotic by bacteria. For this infection, we need injury in skin, wound in skin. There isn't any infection in normal skin. If your hand, if your foot contact with source of this material, there isn't any infection, because for this infection we need the bacteria or fungi transfer from skin to connective tissue under the skin, and after that to bone and the other tissue that lie under the skin. Therefore, we need trauma and cutaneous inoculation by any uh, uh, device like as pin, thorn, thistle. In each condition, we need trauma, injury, wound in the skin. In epidemiological factor in mycetoma, there are many epidemiology factors that affect the rate of infection. One of them is geographical distribution. We have in some countries, like as India, Sudan, Mexico, high frequencies of infection, high number of disease. But in some country, like as your country in Iraq, in Iran, there are a sporadic number of infection, low frequency in some country, in Iran, in your country, in Middle East, but in some country, in Africa, in India and Mexico, Brasilia, we find high number of infection. Subcutaneous mycosis usually, subcutaneous mycosis usually uh, man or male in compare in high number in compared to female. Usually find high number of frequency, high number of infection in male in compared to female, because this infection related to job. Usually find high rate of infection in garden, farmer, and worker with soil. And usually, generally, the male work in this condition. Therefore, we see high number of infection in male. There isn't any different about sensitivity to infection. In same condition, in same job, all both group can obtain the infection, both group, female and male. Another epidemiological factor is age. Yes, there isn't any sensitivity to this infection, but you find the frequency, high frequency in middle age, from 20 to 50 years old, because in this age group, the worker, the farmer, uh, exposed to infection, exposed to soil, maybe uh, show wound and injury in skin in this condition. Therefore, there isn't any difference in sensitivity in relation to sex and age, but you have high frequency in middle age group and in male compared to female. In clinical manifestation or clinical sign, one of the uh, lesion that you see at first, it is a nodule. Do you know nodule what mean? Yes or no? Yes, a small swelling on the skin. It is a nodule. After that, this nodule changed to abscess. Change to abscess. At first, you have single abscess, one abscess, but second, it spread and lead to multiple abscess. Multiple abscess is a good clinical sign for suspect to this infection. Multiple abscess. May you have after a long time period you find multiple abscess with pus, with discharge, and it is a suspected uh, patient for mycetoma. For identify the infection as mycetoma, you must have it correct and good report from laboratory. You must refer the patient to laboratory and examine it. May you have a lesion in all part of body in different anatomic sites in body, but usually find the lesion in foot and the other part of usually find the infection in foot. Look at the picture. It is a typical form of mycetoma. Multiple abscess. This is abscess. This is sinus tract that the pus leakage. You can see many and multiple abscess. Superficial abscess, deep abscess. This lead to edema, swelling of the tissue with fluid, edema, and change the figuration of limb. You see disfiguration. Uh, Maybe the lesion involve hand, maybe involve another part of body. All part of body have same sensitivity, but usually in relation to work and job, you can find lesion in foot. In this patient, you see edema, you see sinus tract for abscess, and change the shape of limb. What do you think about the treatment of this infection? Treatment.
For actinium,
Yes.
for actinomycosis,
Uh-huh. With antibiotics?
anthracycline, type B,
Yes.
nitraconazole.
Okay, thank you for your answer. But about this picture, I question related to this picture. Remove the damaged tissue. It is a part of treatment, but it's not complete. Topic, no, it has deep infection. Cut? Yes. There isn't any direct treatment. You must amputate the limb. You must cut. You must cut from here. And amputation is only treatment. Therefore, we must have as soon as possible diagnosis, correct diagnosis. When you have a patient with this figure of infection, there isn't any drug that affect the fungi and control the infection, or this one, or this one. The the main finding for decide for treatment is radiological picture. The radiological picture. At first, you must prepare a radiological picture. If the infection invade the bone, the treatment is difficult. The progress of infection to bone, there isn't any drug treatment. Therefore, we must start as soon to diagnosis and suspect to this infection and start the treatment. If a patient hasn't any bone tissue involvement, the treatment is good. The prognosis of infection in drug treatment is good. But when invade the bone tissue, the treatment is only surgery. One of tissue that microorganism has tendency to eat is bone, and when the bone involved, treatment is difficult. Water? Yes, yes, yes. Both of them, mycotic, eumycotic bacteria, yes. Both of them. There isn't any different, usually there isn't any different in clinical sign in eumycotic, actinomycotic. The only way for diagnosis is differential diagnosis between actinomycotic, eumycotic is laboratoire method. This is a shape of granule. Granule is compact fungal element or bacterial element that may you see in exudate, in pus. Change in size from micron to millimeter, change in color based on the species of fungi or bacteria from white, yellow, black, red, brown, and really the fungal element or bacterial element determine the color of granule. In laboratory, the granule broken and a study for mycelium for mycotic mycetoma, eumycotic. And for this is in picture, uh, this is mycelium in granule. And in histopathological slide, this is mycelium, this is mycelium, this is mycelium, and diagnosis is eumycotic. This is mycelium, true and thick hive with septum. And in type of actinomycotic, you find thin filament about 1 micron microorganism under microscope observation. The only way is direct examination of tissue material. For tissue material, you can use sample like as pus, deodar exudate, and grain or granule. Grain is similar to granule, like as. We must prepare the smear coat and check it with microscope or stain the exudate for detection branch filament about 1 micron diameter for actinomycotic. And in eumycotic, septate mycelium and chlamydoconidia for detect eumycotic. We have culture. We have culture for identify the species of fungi, especially because there are different in resistant to antifungal drug. We have many species of fungi for this infection. All of them show sensitivity, susceptibility to drug. Therefore, in diagnosis of this infection, we need isolate the microorganism in media on saburo or saburo with chloramphenicol. In mycetoma, uh, usually the infection is spread locally. There isn't any blood spread or lymphatic spread. There isn't metastase. There isn't metastase to the other organ, but the infection uh, involve joint and bone. Usually, the nerve and muscle uh, didn't show the don't show the infection, and it is local involvement. Based on the infection, based on the anatomical site of infection, we have two types of mycetoma: pedal mycetoma, extrapedal mycetoma. This means in foot, the pedal area of foot, because it has a high chance for contact and exposed to source and injury. Usually in pedal area, you find the lesion in sole area. in plantar area. Anybody of any part of body uh, classify in extrapedal mycetoma. There isn't any different in sensitivity to this infection in many part of body. There isn't any sensitivity. But because the pedal area exposed to this infection, it show high frequency. It is another picture for eumycetoma. What is your diagnosis? Actinomycotic or eumycotic? Eumycotic because you see mycelium. This is mycelium. Septate branching or not mycelium. This is actinomycotic. In another stain, you can see thin filaments of bacteria, actinomycetoma. It is a culture of pseudalgeria boydii. It is not important for you, only for your inform you only. Okay, after diagnosis, as soon as possible, you must decide for treatment. Treatment based on the spread of infection uh, has good or bad prognosis. I described it before based on the involvement of bone. For treatment of eumycotic, you can use amphobi and azole. One of I I I don't understand.
She mean first one it is increase the durability of the cell membrane to enter the water and explode the cell and die of the fungi.
In clinical sign, treatment,
Patient take that
at first we must determine the type of mycetoma at first. And second, we must start the treatment based on the type of eumycetoma or actino. Uh, in addition to use of antibacterial drug, we must use some debridement, some surgical treatment. In addition, you must open the abscess and empty the abscess. And for this treatment, you may use topical and systemic antifungal drug based on the type of infection. For eumycetoma, you find amphotericin B as a choice and selective drug. But because there are many side effects, you must use the other antifungal treatment. In the other antifungal drug, itraconazole is important for affect to uh, uh, many species of fungi. Sometimes you must change the treatment. Start with amphotericin B and combinant with azole, or stop amphotericin B and continue with itraconazole. Sometimes at first you have a combination therapy based on the response of body reaction in patient. Uh, in actinomycotic mycetoma, Dobson with streptomycin is a selective treatment. In old penicillin with streptomycin used for treatment, but now Dobson with streptomycin. For prevention of this infection, you must, when you have an injury and trauma that has contamination or exposure to soil or the other material that have contaminated microorganism, you must use disinfectant, and prevention the growth of microorganism in wound or in skin injury. It is very important that you decide for prevention. In first question, we have which disease show tumor-like lesion? Yes, all students answer correct because at first we describe the answer. Okay, before I start another infection, we check this question. In which disease there is lymphocutaneous type? One of question. In which disease there is lymphocutaneous type? Mycetoma? No. Tinea versicolor? Aspergillosis? Yes. Sporotericosis? Uh, take up your hand for this answer. Sporotericosis. It's correct. Is correct or not? Take your hand. Somebody that answer is correct. Approximately half have incorrect answer. Yes, the answer is sporotericosis. The answer is sporotericosis. Another question before I start the sporotericosis. Uh, in which disease, in which disease, in which disease fungal pathogen source may be in flower? There isn't any sporotericosis is answer. There isn't. Yes, sporotericosis. Okay, another infection that we might speak and describe is sporotericosis. Another name Another name is Rose syndrome. Because why?
because under microscope, like
Uh, because at first time, uh, the people with finger lesion that work with flower, rose flower. You know rose? At first, rose flower show the man work with flower with finger injury without any treatment and you, routine treatment. Any answer? Rose syndrome is synonym of sporotericosis. This infection show a skin lesion and sometimes lymphatic infection, lymph adenopathy. And this condition, lymphadenopathy, may transfer the infection microorganism to the other part of body, from skin to internal organ in sporotericosis. It is a dangerous infection because maybe at first have local infection, second spread of infection to the other part, for example, in brain to skeletal system. The fungal cause of this infection is Sporoteric Schenke. Sporoteric Schenke is a dimorphic fungi. Do you remember dimorphic fungi? They have two shapes, mycelium and yeast. It is a dimorphic fungi. In soil, in out of body, mycelial form. And when entrance to body, change to yeast form. Because it has tolerance to body temperature. And really, the pathogenic form of this microorganism is yeast form. Normally, unfortunately, I don't know your accent. If you write your question, it is better. I cannot. No, it is better. The- the- we have two. What is the condition? Normal condition. Normal condition for change. We have two way. We have two way for change the morphology. One in media, in culture, in 37 centigrade degree. Mycelial form in 25 and 37 for yeast form. When this microorganism enter to body from one, this is similar to media. This is similar to media in 37 centigrade degree. This is the condition that may change the microorganism. It has a process, but there is not important for you, the process and the mechanism. These fungi exist in soil and plants. It is a dimorphic fungi, mycelial phase in 25 centigrade and yeast phase in 37 centigrade in body and in media, in rich media. Skin injury contact with this contaminated source lead to transmission of fungal elements to under skin tissue, connective tissue. Usually, the worker, the farmer, work with flower. Usually, the microorganism exists in flower and transfer from wound to connective tissue usually, but they are the other way for this infection, for transfer of this English a relation inhalation inhalation for lesion inhalation respiratory way usually no. I explain it. In this infection usually generally via the skin lesion, sometimes seldom respiratory way may occur, seldom, rarely. You must have injury with flower spine usually, but there are the other way. Any instrument that make trauma in your skin, any instrument. Insect bite, another way. All of them is trauma in the skin because the main way is a skin lesion, not air transmission. Uh, Insect bite is mechanically. What is mechanically and different from physiological transfer? Uh, in parasitology, you have uh, malaria and leishmania. That transmission is physiologically because the microorganism change. It has a circular part in insect, but in mechanically transmission, only the bite by insect transfer from flower to wound. Did you study parasitology? No. Oh, yes. In malaria and in leishmania, the transmission is physiologically because need the malaria or leishmania uh, enter to body to insect body and change in morphology and change in uh, some metabolism, produce metabolite, and after that, this infected insect can transfer the infected agent to normal person. But in uh, sporotericosis, the insect bite is generally mechanical. Animal bite, may the sporoterics inoculate in skin by animal bite, dog bite, some bird like a parrot bite, rodent, mouse bite. Sometimes may transfer with watery instrument or watery uh, animal, fishing hook injury, fish skin injury. Sometimes we have report. And main one of main transmission can occur by cat scratch, because this animal has sporotrichs on their nail, and with scratch transfer the microorganism to uh, under the skin connective tissue. Like as mycetoma, we have some uh, country that show high frequency of disease. In some country, like as Mexico, Brazil, you see high frequency of infection as endemic area. In some country, we see sporadic of infection. Do you know sporadic what mean? Sporadic mean seldom, seldom, rarely, low number of infection. I think in your country, the respiratory causes is low. But because this infection is important and may dangerous, we must know and we must have some information about clinical and epidemiological factor. It is an employment uh, disease because you find high number in farmer and gardener. Both sex are sensitive, but we find high frequency in male because it is an employment disease, job disease. In each in each age group, you can find this infection, but like as mycetoma, high frequency, high number of infection in 20 to 50 years old. Clinical type of infection. We have four types of infection. Fixed cutaneous, lymphocutaneous, mucocutaneous, and extracutaneous. What is, uh, you think, what is the difference between fixed cutaneous and lymphocutaneous?
And in the lymph it transfers from skin to another organ by lymph node.
Mm.
So
Yes, yes.
like
You? This is correct answer. In fixed cutaneous, we have only a skin lesion. But in lymphocutaneous, at first we have a skin lesion, but the infection transfer via lymphatic vessel, lymphatic tissue to the other organ, to a skeletal system, to brain, to eye, in male to testes, to liver, to lung, and in sometimes we have extracutaneous or disseminated form after lymphocutaneous. In lymphocutaneous type, in fixed cutaneous, we have only a skin lesion. In lymphocutaneous, we have not only a skin lesion, but transfer the infection to the other organ. At first, a skeletal system, bone tissue. Second, eye, May we have blindness with this infection, and brain infection, lung infection, lymph node in mediastinum may show the infection, and mistake with the other infection like as tuberculosis. In extracutaneous, we have disseminated form after lymphocutaneous. Extra mean the infection spread from lymphatic vessel to the other part. This means extracutaneous.
The infection spread from lymph node to another organ.
Yes,
So we have
yes. In mucocutaneous, thank you. In fixed cutaneous, we have, I explain it after. In fixed cutaneous, usually you have single lesion, single, one lesion. Scaly inflammation, redness, and sometimes necrosis. Necrosis. Scale necrose wound, usually with single. Any part of skin may show this infection. Sometimes finger. You have a lesion with ulcer form in this picture, ulcer form, or a or an ulcer form and necrosis and vesicular type. Usually, this infection you haven't any healing after a treatment with generally normal. Usually, use antibiotic or anti uh, corticosteroid therapy. There isn't any healing, and you must check for fungal infection. In subcutaneous mycosis, one of the most important information that may help you to diagnosis is take a history. History. You must prepare history. History is very important. Do you have any older lesion, before lesion? What is your job? And age. It is important. We have a farmer. We have a farmer with trauma, with ulcer in foot. That in history uh, he has a wound contaminated with soil. It is really important. You estimate for and suspect for subcutaneous mycosis. In subcutaneous mycosis, prepare the history is very important, especially for physician and after laboratory. Yeah, sometimes the sometimes the fixed cotanus made sometimes multiple lesion, but in a limited area. But in lymphocutaneous, you have multiple lesion in uh, the other part of skin because the microorganism transfer via lymphatic vessel the other part. Usually, multiple lesion you can see in hand or in foot. At first, you have lesion in uh, tibia area, but via the vessel, lymphatic vessel, the microorganism transfer to thigh. Secondary lesion you find in the other part of body. It show there are uh, lymphocutaneous form of infection, you must, in this patient, check the lymphatic vessel. You must check the lymphatic vessel and search the lymph node because you have enlargement of lymphatic vessel and lymph node in axilla, in groin area, inguinal lymph node. You must check it. You have a patient with multiple skin lesion. You must check the lymphatic vessel for lymphocutaneous form. You must prepare the history and totally decide for sporotericosis. It is not clinical. It hasn't clinical diagnosis. You must refer the patient to laboratory, and in laboratory with in laboratory with direct and culture method diagnose the infection. In in mucocutaneous type, you can see lesion in a skin and mucous membrane. Do you know mucous membrane? Okay. In nose, one of site of skin that show mucocutaneous in nose. The infection spread to mucous membrane and after that to oral cavity. There is a dangerous form of mucocutaneous involvement of pharynx and larynx, and usually there isn't any diagnosis, correct diagnosis, and you have misdiagnosed, and the treatment is not good and not correct because usually you think there is viral infection or bacterial infection. Uh, in this patient, you have fungal infection. Treatment is completely different. In extracutaneous type, we have dissemination of infection. At first, bone tissue, second, eye, lung, any organ. In respiratory infection, we may see pneumonia, bronchitis, and adenopathy. Adenopathy means inflammation of lymph node in mediastinum. Because
what is the differential diagnosis? We need
or the only there isn't any clinical diagnosis. The only way is laboratory techniques. The only way. You cannot find for uh, this infection and especially clinical sign. You must suspect to infection and refer the patient to laboratory.
maybe make mistake diagnosis.
Yes, yes, yes. Yes. In in laboratory, we check the sample. We check the sample with direct microscopic examination and culture. Both of them need direct and culture. If if we isolate, if we isolate the colony, if we isolate the colony in media from this lesion, it is a way for diagnosis of sporotericosis. It is a colony in mycelial form. Is mycelial form. If you check it under microscope, show rosette pattern form of sporulation. This is rosette pattern form of sporulation. If you isolate this colony from the skin lesion, you can decide for sporotericosis. It is a laboratory technique, an important technique for diagnosis. Another shape, rosette pattern of conidia. Rosette pattern of conidia. At first, you isolate the colony and check the colony under microscope. If you see rosette pattern of colony, this is sporoteric Schenke, and the infection is sporotericosis. Sometimes in tissue material in histopathology, we have a reaction that name is asteroid body. Asteroid body. Asteroid body. In histopathological aspect, may you see asteroid body. Asteroid body in this picture. Really, it is a immunologic reaction between antigen of microorganism and antibody that complex around the microorganism. It's like as a star and well known as asteroid body. Indirect, indirect examination of tissue, we must search for yeast form because it is dimorphic fungi. In direct examination of this infection, you must search for yeast form of microorganism. But this yeast form show uh, multiple or many shape of microorganism in yeast form. Cigarette shape, boat shape, uh, ovoid shape, multimorphological aspect in direct examination. But it is important that you isolate microorganism in 25 centigrade degree, this colony, and check it for rosette pattern sporulation of sporoterics. Uh, Treatment. If you, in this infection, if you have correct diagnosis, the treatment is good in compared to mycetoma. Mycetoma treatment is not good. But in this infection, you must have correct diagnosis because we have many disorders that show clinical signs similar that. And physician at first take a history and prepare second transfer refer the patient to laboratory and check the answer. In laboratory, culture the tissue material and the diagnosis with sporotericosis or sporoteric Schenke isolation. After good and correct diagnosis, treatment with iodine compound, iodine solution orally with milk or water. It has a protocol. Start with 15 drop per day, continue to 15 drop for day, about 45 drop per day. Sometimes you have some allergic symptom to iodine orally, gastrointestinal sensitivity. Therefore, you can use iodine injection. It is iodine compound is choice drug, selective drug, but you can use the other antifungal like as amphotericin B or the other of azole. At first, iodine is better. May you have a patient with allergy to this microorganism, this compound. Therefore, you must change the treatment. Okay, we have a rest and start at 10 o'clock. We must speak